Although your fingers may seem to be swelling for no reason, ONsalus Health explains why there is always a cause behind this worrying symptom. Any condition which affects your hands can threaten their mobility and functionality, limiting the various interactions we otherwise take for granted. This swelling has various causes, including trauma, infections, and fluid retention. We explain these causes and more, as well as what risk factors may be involved. Causes of finger swelling. Inflammation of the fingers has a wide variety of causes. Liquid retention. Excessive consumption of salt in meals makes it difficult for the kidneys to eliminate fluid, resulting in accumulation in the fingers as well as other parts of the body. Heat. When the ambient temperature is high, the blood vessels in the hands dilate. This causes increased blood flow, releasing heat from the body as a way to cool down. It also causes fluid retention and finger swelling. Trauma. Inflammation is a common result of fingers being struck, crushed, sprained, or dislocated. After having suffered any of these kinds of trauma, the body will send extra blood and other fluid to the injured area to help with healing. This inflammation is the body's natural response. Exercise. During exercise, your hands and fingers can become swollen as the body's blood vessels are responding to the increased energy demand of your muscles. When exercising, the body produces heat and the vascular system allows more fluid to be released into the fingers and toes. In turn, this causes them to swell. Rheumatoid arthritis. This is a chronic autoimmune disease that is characterized by inflammation of the joints such as those of the fingers of the hand. Psoriatic arthritis in particular produces this type of alteration. Infections. Infections resulting from injuries to the fingers can cause inflammation as well as pain and sensitivity. These infections are caused by bacteria such as Streptococcus and Staphylococcus aureus. If this video is helping to answer your questions about swollen fingers, consider providing a super thanks to help our channel grow. Carpal tunnel syndrome. This condition affects the wrist, specifically the nerve that runs from the forearm to the palm of the hand. Various issues can result in this nerve feeling pinched or compressed, resulting in pain, tingling sensations, and inflammation of the joints of the fingers. Lymphedema. It is a swelling caused by the accumulation of lymphatic fluid. It's common in people who have had their lymph nodes removed or damaged during cancer treatment. When the auxiliary lymph nodes are removed, there is an increased risk of developing lymphedema in the hands for months or years after receiving treatment for cancer and other diseases. Pregnancy. During pregnancy, the body produces up to 50% more blood and bodily fluids which tend to accumulate in the hands or feet. This is why it is common to see hands and feet that are more swollen than usual in pregnant women. If you want to know more about the myths and realities of pregnancy, check out the info video we share above. Preeclampsia. This is a condition that occurs during pregnancy due to high blood pressure. The characteristic feature is edema in the face, hands, legs, and feet. Kidney problems. When the kidneys don't have the ability to eliminate excess fluid, the body retains it, causing inflammation and fluid buildup in various parts of the body, specifically the hands, feet, legs, or ankles. Medications. Some medications can cause swelling in the fingers as a side effect, such as those used to treat high blood pressure, diabetes, steroids, and birth control pills. Raynaud's disease. This is a syndrome that is caused by a narrowing of the arteries due to cold or stress. The narrowing in question decreases blood circulation, causing swelling and even tingling in the fingers when circulation returns. How to treat finger swelling. Finger inflammation needs to be diagnosed by a physician, but there are some ways we can help reduce swelling. When inflammation occurs due to fluid accumulation, it's recommended to keep the affected hand elevated, helping the fluid to disperse and gradually reducing the inflammation. Apply ice or place a cold bandage to the affected area. Anti-inflammatory medications such as ibuprofen can reduce swelling, but your doctor will prescribe the most appropriate for you. Moving your fingers, wrist and arm frequently will pump the fluid back into the body. Squeezing a stress ball is particularly helpful. Using compression gloves will quickly improve the inflammation in the fingers. If this alteration is the result of an infection, the doctor will prescribe antibiotics to eliminate the bacteria causing the inflammation. This is our ONsalus Health video for today. If you wanted to continue learning about other ailments, don't miss the playlist we share here. Like and subscribe for more health videos to come, and we'll see you next time.